Hi, Kristen. Shauna Roy here, just responding to your video blog on pediatric anxiety. I thought it was really well done, straightforward, and you made some really interesting points that I wanted to bring up and talk about. The first one being when you mentioned IBS or irritable bowel syndrome, that made me think of kind of a situation like chicken or the egg, because we see so frequently that bowel issues, diarrhea, stomach aches, are a result of anxiety and psychiatric conditions. You know, when you feel anxious, your belly just doesn't feel good, and that can be pretty common in kids. But it also made me think of the effect of something like this, like having IBS could have on a child's psyche, and how important it is for them to appear quote unquote normal and be able to socialize normally with their peers, and how disruptive a bowel disorder could be to a developing child. So that was something that I thought was important. Which is resulting from which? Is the anxiety from the bowel disorder, or is the bowel disorder resulting from the underlying anxiety? I also agree and think it's so important that we talk about the instance of child abuse, and how at every visit, no matter what, we should be having that in the back of our mind, that almost any complaint, headaches, fatigue, anxiety, stomach aches, can indicate that something might be going wrong at home, because as we know, a supportive home environment is really so important to growth and development and being a well child. And if something's wrong at home, then certainly we can see complaints of anxiety or other physical complaints even. So we should always be aware of those kinds of things. You also talk a lot about substance abuse. And I thought that was interesting. I couldn't really think, maybe you have experience in your clinicals, or maybe with an older pediatric population, like adolescents would have more of a tendency to be experimenting with abusing substances. But I had spoken about in my video blog about substance use, totally appropriate substance use, that can cause anxiety in children, especially bronchodilators, asthma meds, and corticosteroids. That made me think a lot of how those can cause anxiety in kids. So it's important to know what other medical conditions they have and what medicines that they're taking for those. And then I thought your guidelines for the follow-up meetings for SSRI and SNRI therapy were really helpful, because everywhere they do stress that we need to be following up closely with these patients. But I thought the way that you put it forth, meeting weekly for the first month and then bi-weekly for the second month, really was a good guideline for keeping those patients from falling through the cracks and making sure that we know that we're getting a positive response from therapy. And lastly, I thought that stressing the importance of developing coping mechanisms was a great point that you made, because this might be the first time, depending how old the child is, that they're experiencing a situation where they require advanced coping mechanisms, whether that's divorce, loss of a family member, issues in school. It might be the first time this child's encountering the need to develop those coping mechanisms. So it's important that they feel supported and that they learn what works for them besides putting them on medicine. And so I think it's important that we as providers work with the child and the parents and the family to make sure that we're actually teaching this child how to process his or her emotions and his or her anxiety, rather than just putting a Band-Aid on it. But thank you again for your video blog. I thought it was great, very informative, and looking forward to seeing more. Thank you.